Welcome to the Power of Your Voice podcast with your host, Johnny Gorky. You have the power to overcome challenges and fears. Let my voice and the voice of many others show you how to transform these challenges into opportunities. To learn more about future podcasts and read episode show notes, check out my website at www.thepowerofyourvoice.com.
This is episode 22, and today's guest is my good friend Dr. Nicholas Vernola, Jr., who's received his doctorate in physical therapy from State University of New York at Stony Brook. He received his undergrad degree in kinesiology and exercise science from State University of New York College at Cortland. Not only is he an amazing pelvic floor specialist, but he's also the type of person you want to be around if you ever get lost in the mountains. Nick earned his Eagle Scout through the Boy Scouts of America. So during this episode, you will discover the many benefits of physical therapy that you may not have been aware of. While many of the topics we discuss today are going to be very serious things, you also have a great laugh, as well as some of you may even think of physical therapy if the field would be a perfect fit for you in your career. Today, I'd like to welcome my good friend, Dr. Nick Vernola, Jr., to the Power of Your Voice podcast. Welcome, buddy. So, Nick, tell us, where are you from?
Well, I'm originally from New York State. I grew up on Long Island, and I work in Atlanta, Georgia now, which it's been my dream to move down here for maybe the last 5 or 6 years.
Yeah. Okay, cool. I love it, man. Well, a lot of people move here, especially from New York, because it's so much warmer down here. So I'm going to start this podcast episode with you, buddy. So asking you some questions about physical therapy. So what made you decide to pursue your doctorate in physical therapy?
I think a lot of physical therapists are drawn to the field early on, in their college, high school careers because of their own athletic injuries. But I really just knew that I wanted to do something in healthcare. And I actually, when I was shadowing different healthcare professionals, doctors, physical therapists, occupational therapists, etc., I really liked the rapport that the physical therapist was able to build with the patient. And it just seemed a lot more personal than a lot of the other professions. I was actually due to go overseas into a medical program originally, and kind of wound up falling in love with physical therapy. So
cool. So what was that actually that you were going to go overseas for?
It was a medical program called Samwise University. It was in Budapest, Hungary, and you take their version of the MCAT. I went to California to take it, and I was accepted into the program, and I got cold feet. And then wound up shadowing around, like I mentioned, and fell in love with physical therapy. But the program is pretty much a 6-year straight shot track to your medical degree, where it's all included. It's the college is all geared towards your medical degree, so you don't take like the history classes or English classes. I mean, it's in Hungary, so it wouldn't really be relevant to be taking English. But anyway. So that's pretty much it. It's a fast track to your MD.
That's awesome, especially seeing that my father's side of the family is from Budapest.
Yeah, I remember. I'm surprised I never told you about this.
No, you never did. So my next question for you is, you are a physical therapist and you specialize in men and women's pelvic health. What piqued your interest in this specialty? What exactly through your life made you decide to even pick this kind of career path? And did you have any challenges when you first started? Because honestly, this is a predominantly women's specialty. There's not a lot of men that do this.
Mm-hmm. Yeah. The thing that got me into it, it was my first semester of PT school, and I remember there being a class in clinical medicine about spinal cord injuries, and they were talking about surveys that they had taken, and that people with spinal cord injuries tend to wish to have bowel and bladder control more so than they wish to walk again. So I thought that was interesting. And so I went home, and over the weeks I did some research and found that, there was something called pelvic floor physical therapy. And So I decided to go around and shadow urologists, gynecologists. Couldn't really find any pelvic floor physical therapists in the area, and found that there was a need for it. And through my online research, I found that there were some really great outcomes associated with it. So I kind of fell in love with it and thought that I would have a greater sense of purpose within the field if I pursued this niche. As for things that were barriers to getting into it, I mean, you mentioned me being a male and it being a female dominated field, which is correct. That was pretty much the biggest barrier. I mean, I started taking the pelvic health courses through I'm not going to say what institutions, but I started taking some certification courses to specialize. And, in these courses, I was ultimately put in a corner in the room and with curtains around me, almost, I would say like an animal in some cases. Could definitely have some friends from those courses who will attest to that. But yeah, I mean, that was the biggest barrier, is pretty much being a male in a female dominated field. So it was challenging.
So like when you were in those classes, were you like the only guy?
Yeah, I was not just like the only guy. I was the only male physical therapist taking the class.
So did anyone like question like, why are you doing this? Or, did you ever think, hey, maybe I shouldn't do this? Or did you just, so no, this is something I'm passionate about. This is something I'm going to do.
Yeah, it never really came down to that. People did ask those questions, but not as with definitely with good intent. It wasn't like a "what are you doing here?" It was more like a "wow, this is interesting." Like, what are you doing here? It was more welcoming from the student perspective, which was great because having had to bring my own model, and it costs a lot more money to do that because pelvic physical therapy models want a lot of money, and yeah, so it was nice to have the students kind of by my side and being very open, and even some would identify themselves as people who are willing to work with me in the class, which was great. It didn't help with courses down the road. The organization still required me to bring people in for the second course. And I had to fight with them a little bit to let me into the third course without bringing a model because it was male anatomy. And even that, I had to twist their arm a little bit. But yeah.
So when you say that so you actually bring in people, or you're bringing like a model, or how does that exactly work for somebody who might be listening to this episode and they have no idea what you're talking about?
So there's a few criteria that requires you to bring a model, one of which being a male student. So if you're a male student in the female anatomy course, the idea is that you're not going to be able to reciprocate as a lab partner. So they require that you bring either a friend who can stand in for you as your pelvic model. You would not get to work with anyone else unless you identified them yourselves within the class, or you had to pay someone outright. So I would email college universities, other graduate programs, hospitals. I had people asking for upwards of $2,000. And I remember I wound up getting to a point where I was like, I guess I'm just going to, I had to just shell out the money. And I finally agreed to that. And I would say a week before the course, that person emailed me back and said that the $2,000 was not enough money for them to do a 2-day weekend course with me. That was only going to require them about, I think it was like 5 hours max of work between the couple to 2 to 3 days that it was. So thankfully, someone had by the name of Darla Cathcart. I'd like to say her name because she is just amazing. She identified someone who was a student who was willing to work at a much lower rate, though still expensive, but much better. And she was much more reliable. And, I still talk to her to this day, actually. She's great.
It's incredible because like everybody I interview, everybody pretty much has had a time in your life where, they had to overcome something. And it's just amazing how you're just able to naturally work things out. Everything just works out. At the time, you're like, oh my God, what am I going to do? but you just get somebody that is able to support you in some way, shape, or form, and you're able to do what you're meant to do, which is exactly what you're doing today. So this is an important question, and this is actually something I pulled off your website. There are approximately 300 million people in the United States, with over 50 million of those men and women being affected by some form of pelvic floor dysfunction. Why is this expected to double by the year of 2020?
That information came from some articles that I had found through Google Scholar. It's a few years back now already that I had pulled that information. However, I believe the reason why it's expected to double, though I don't remember there actually being something definitive as to why, but I think as the popularity of pelvic floor physical therapy and as it becomes more commonplace in the physical therapy practice and the common physical therapy practice. So you're seeing more physical therapy clinics that are generalists, but they're bringing in pelvic floor physical therapists. I think as it becomes widespread known amongst the general population, even so the clients, the patients, you're going to start finding that people are going to be going more towards physical therapy for their pelvic floor versus surgical or medication for management of it.
Which is actually a really good thing, because yes, doing physical therapy is the better alternative versus going through surgery because you're doing it naturally. But the other thing I was thinking about maybe also too is the reason why it might be doubling, it's increasing, because you got a lot of kids who playing sports, you got adults who playing more sports, then you have some women, unfortunately being overweight or obese. Like for example, in pelvic floor, you are working with pregnant women or post. So after they give birth, maybe because if they're obese or that kind of thing, there could be complications, which would also increase the reason why you might need to see pelvic floor specialist.
Yeah, absolutely. I mean, that could 100% be a reason for sure. I mean, it's all speculation as to why it would be expected to double, but I think a major reason would be that more people are learning that it's an option.
Why would you say that is? Because a lot of people weren't familiar with pelvic floor?
Oh yeah, absolutely. I mean, I couldn't even tell you. I mean, at least 50% of the time, I have a patient sitting across the table from me while we're going through, the interview portion of it. And one of the first things that they'll tell me is, I don't know why I'm here or what a pelvic physical therapist is. So these are people who are coming with issues that they want to get rid of so badly that they literally went to a stranger in a profession that they just don't even know what they're doing there for. They go to the doctors or the medical doctor's office because they're expecting a solution, a known solution. But physical therapy, everyone comes in, they're just, what am I doing here? What are you going to do? Stretch my legs or something?
So then to the question, or to add on to that question, because there's always a question. How long has pelvic floor and men's and women's health been around?
Oh, that's a good question. I'm politely going to have to skip that question and get back to you because I just don't know the answer to that.
Come on.
Just honestly, I don't know. I'd have to get back to you on that one. I mean, it's funny that you asked that though, because it was a question that came into my own mind the other day while I was at work. I think it was like lunchtime or something. I was just finished working with the patient. And I'm thinking, I wonder when someone actually thought to look at this from a physical standpoint. I do remember in the most recent course I took, they did have some mention of pelvic floor physical therapy and when it came to be. And I just don't know. I just don't remember. It wasn't something that really stuck with me because it wasn't too relevant to treatment, I guess. I was there with a one-track mind.
Yes, but it is what you do.
Yeah, exactly.
So, Nick, why do you think the general public is shy when it comes to discussing men and women's pelvic dysfunction? And what do you think can be done to change it?
So I think that the reason that people are shy about it is one, it's a very personal area. It's very intimate. So nobody wants to talk about their intimate part of their body, which is elsewise they only talk about with, we'll say, a sexual partner, with the person across the table from them. Um, but the fact that pelvic floor physical therapy is just not that well known of as a treatment option means that these people are also probably not going to their friends and discussing it, because they think that, oh, they don't have these issues, probably it's probably just me. Some people just think it's normal. I hate hearing that. This is just normal for me to pee myself every time I cough or sneeze. I just, because there's something you can do about it. But I think that that's a major part of it. It's a part that people aren't used to talking about. They're embarrassed to talk about it, especially in the way that you see it's portrayed in movies. And the way people unfortunately lie about it to their friends, orgasms, people who are unable to attain an orgasm. You see groups of people sitting around at a table talking about how they orgasm all the time, or they're multiple orgasms, and they couldn't imagine living without one, and all of this stuff. And then the person next to them, probably the next three people next to them actually, are in their minds thinking, oh, well, I've never had one of those. Why? Something must be wrong with me. And I just don't know what to do about it. They don't know who to go to for it. So I think that's a major reason why people don't wind up doing anything about it. And then what can be done to get people to do it more? I just think public awareness, like that. It's kind of what I made my website for. There's no profit to be gained off of my website for me, other than just the only gain I have from it rather is to get information out to the public, so they know that there is an option for them, so that they can live happier lives as it pertains to their pelvic floor. That there is another option besides surgery. It does not always have to be this way.
Wow, that's great, because I was just thinking of, this is not something I even thought I was going to ask you, but there are, I've heard it many times. You hear guys or women might say, yeah, I've never had an orgasm. So what you're telling me, a person who's never had an orgasm could possibly get that corrected by working in pelvic floor and seeing someone who specializes in pelvic floor?
Oh yeah, 100%. And I work with those people. I think the statistic right now is 40% of women they say cannot have an orgasm. I personally think that statistic is flawed, only in the sense that 40% probably haven't tried pelvic floor physical therapy. So they never, they didn't have the chance to try. So yeah, people can have good positive results towards achieving an orgasm through physical therapy.
That's incredible. When you really think about it, a person honestly has nothing to lose by at least trying to see somebody like yourself.
Yeah, that's absolutely true. There's literally nothing to lose, and only things to gain, even if you don't necessarily achieve, whatever your ultimate goal is. There's still going to be those small victories as we go along, and you'll still learn that you do have the power to take control to at least some degree. But I would say that a lot of the people that a vast majority of the people I wind up working with, we wind up having just absolutely great outcomes, and we get to the finish line, for no matter what it is almost.
Yeah, well, and the beautiful thing is you are so extremely good at what you do. I mean, I can tell working with you for over a year, you are extremely passionate about it and you make such a big impact in these people's lives. So yes, that's great. Hey, Nick, so when someone visits a pelvic floor specialist, what can they expect and what types of conditions can they have corrected?
Okay. So, the number one thing that I want to get out there that they can expect is that it's not necessarily going to require an internal pelvic exam. I can still probably count on one hand how many times on the first visit we did an internal rectal or vaginal exam. A lot of this can actually be managed without ever touching those areas. So that's something. It's largely education, and then a lot of it will come from function in terms of breathing and postures and stress management, things like that. Even dietary changes, staying within the scope of practice of a pelvic floor physical therapist, of course. We can't talk about specific nutrients, things like that, foods. But we can talk about things that are dietary irritants for those people who may be experiencing increased urgency to urinate throughout the day. But I guess that kind of brings us to the next part of the question, which is what types of conditions can we see? There's people who are incontinent, people who are losing urine, when they cough or sneeze, or even might wind up just losing it from the sound of the sink running. Those are kind of things that we might work on. And then on the other side of it, people who can't pee, who are retaining their fluid too long, and they can't ultimately start the stream of urine. Incontinence and retention. And then, the other part, fecal incontinence. So, urine, feces, having an issue holding it, having an issue getting it out, those kind of things. And then we already talked about the orgasms, sometimes erectile dysfunction. I've even seen, the major one, pelvic pain. Pain during intercourse is huge. A lot of people, at least recently, I feel like I've been seeing a lot of young females who have been having pain during intercourse. So those are just a handful of things that I may wind up dealing with through the course of each week.
Well, and the thing that's so important is all these topics, all these things that you are able to help people with are so extremely important. And the incredible thing is when you think about it, these are things that people don't have to live with. And just like you were saying earlier, some people probably think, unfortunately, I've been given this body and this is just the way I'm supposed to be. I'm supposed to be miserable. But the truth is they don't have to be. There's actually help out there. And now they get to know that somebody like yourself can help them.
Yeah, absolutely. And, that's what I want. I think that's what all pelvic floor physical therapists want. You just want people to know that they have a choice to live just a much happier, healthier life without having to go through, necessarily surgery or taking medications.
Yeah, well, and just thinking about it's like, I have two sisters, and not that we've really had these discussions, but being around women, you do hear women saying, oh, some of them don't have sex because it's so painful, and you're able to help them with that. I mean, that could really help someone's marriage. You have somebody after, they give birth, they sneeze or they might go in their pants, and you're able to help them with that. That's a huge thing.
Yeah, absolutely. And I think there's a bit of, sympathy that gets us pelvic floor physical therapists into it, or that empathy factor, like I was talking about, in the beginning of the podcast, where a lot of physical therapists get into it because they experience a similar issue. But then also, those who just, you think, man, I would just never want this to happen to me. I'll tell you a story actually quick. A woman who I was working with was suffering from fecal incontinence, and I felt so bad. She came in, and one of the stories she told me when we were going through the subjective interview type portion was that she literally evacuated her bowels as she was walking up to the casket of her brother's funeral. And I was thinking, oh my gosh, the embarrassment of that. I would never want to go through that. Your heart goes out to them, and you want to help them so much. But yeah, so that's just part of why you kind of get into it, right?
Yeah, well, that could really make a big difference in someone's life, because you think about, guy, girl, if they have a condition like that, maybe they're single and maybe they want to go on a date with somebody, and because they have the issue, they may never go on dates because they think, oh, this might happen to me. And if you're able to help correct that for them, I mean, that could really make a big difference in that person's life.
Oh, yeah.
Silence. Okay, so here's a great question for you, Nick. As a physical therapist and specialist in men and women's pelvic health, what is the most rewarding thing about your job? Kind of like what you just briefly discussed, but what are other things that's very rewarding for your job?
Do you mean besides walking past the candy at the front desk when I go to get people from the waiting room?
Of course.
Oh, okay. I guess I'll go. That'll be the second most rewarding, because sometimes there are peanut butter cups up there. But anyway, no, the most rewarding part is really that I think the first I wouldn't say the first attainment of a goal, but when someone tells me for the first time, well, that's exactly it. This week was the first time in X amount of years, or in my life, that I was able to, and then insert here. I mean, be intimate with my partner without being in complete agony the whole time, or get through my full day of work without having to change one of my diapers during the day. Things like that. The very first, any inkling of progress, it doesn't necessarily have to be anything grand. That is the most rewarding part. Even more rewarding than, I think, the end goal when you're discharging and things are ultimately all better. It really is just that first glimpse, because you can see it in their faces. I can almost tell when I go out to the waiting room, when they're sitting there within the first few visits, which one of those visits, when they're sitting out there, is the day that they're going to come back and tell me one of those things. You could just see it in their face. You can feel it in their aura. You can sense it in the way that they shake your hand when when you're saying hello. That's the big one.
Well, and just thinking now, it's like being a pelvic floor specialist, like what you do, one of the reasons why it's so important is because it's also a big social thing. These are things that people like, when you do physical therapy, you got people who come in for knees and hips and elbows and wrists and shoulders and all those kind of things. These are things you can physically see. But the things that you specifically deal with are things that could really prevent a person from being social, like hanging out with friends, family, that kind of thing. Like some of them might not want to go out and live a life because of these issues, and you're really able to help that person, which is such an important thing to do.
Oh, yeah. It's very rewarding because, again, that sympathy factor, I want to be able to go out with my friends and not have to worry about, things like that. So I want to bestow that upon others as well.
Yeah, I mean, people might not even think of us. Like, for example, you pass gas. I mean, this is something everybody does. It's no big deal, right? But for some people, they might pass gas and they could accidentally go to the bathroom by themselves.
That's right.
And you hang out with your friends and family, that could be very embarrassing.
But just the important thing to know from all of this is just, I hope that anyone who's listening will recognize now that there's something that you can do to make things better.
So so if you're listening to this episode right now, if you're struggling with this, see a pelvic floor specialist or someone in your family, a friend of yours. There are people out there who can help you. So for my next question, Nick, so what advice do you have for anyone who's thinking about getting into physical therapy? And is it good to even have a specialty?
Oh yeah, it's definitely good to have a specialty for sure. You got to go with what you love. I mean, physical therapy, unfortunately, is becoming a saturated field now. It's becoming harder and harder for people to find work. So having some niche is actually probably important, probably really important, and probably becoming the standard at this point. So yeah, I think it's really important for you to identify, what populations you want to work with. Identify what you love in an individual, specialty of physical therapy, and stick with it and become the best that you can be at it, because ultimately that's where you're going to be the happiest, and that's where you're going to make the biggest impact in other people's lives, which is ultimately, what you're trying to do, a positive impact of course.
So if someone is listening and think about getting physical therapy, do you think it'd be a good idea maybe to volunteer or hang out with physical therapists, kind of see what they do by shadowing?
Oh, 100%. I actually have someone shadowing me right now that she comes in 2 or 3 times a week, college student. But yeah, get out there. That's how I figured out that I didn't want to become a medical doctor anymore and wanted to get into physical therapy in the first place. You got to get out there and shadow. You got to figure out if you really can show up. I mean, ultimately, you have to decide if you were to have to go to work every day for the rest of your life, could you do this? I'm not even talking about like, oh, could I do this 3 days a week for 12-hour shifts? No, if this is something that you can do for every day of your life and be happy, then yeah, you got to, that's the profession for you. So get out there and shadow and identify your niche.
And definitely find a good mentor, somebody you look up to.
That's what I got you for, Johnny.
Yeah, man. So next question, because this is, I think, a very important question for the general public. What challenges do physical therapists face today in terms of health insurance when it comes to patient care? Because I think this is a very important question. People come in, they do physical therapy, and a lot of times they're not really sure about, like, does my insurance cover this? How long are they going to cover this? And I think, being someone who's worked in the field for several years, like, a lot of times people are not even sure what kind of coverage they even get when it comes to the physical therapy.
Yeah, no, it's an unfortunate truth. And, the thing that I find the most challenging about working with insurance companies is just that they pretty much dictate what you can treat and kind of how you can treat too. A lot of insurance companies require a prescription, especially Medicare, Medicaid. They require that you have a doctor's prescription. So that kind of takes out the whole doctoral aspect of what we do, which is being able to see people kind of off the street and kind of diagnose somewhat for them, and then kind of maintain rapport with that doctor. So the insurance companies ultimately dictate what we can treat. So unless the doctor says, no matter which insurance company it is, unless the doctor says that we can treat or evaluate X body part, you really have to stay with whatever they showed up with. So if they show up with something for their hand, you can sporadically evaluate their foot and not get it approved by a doctor and then the insurance company.
So for somebody who's thinking, gosh, I could use some physical therapy, what's something that you would tell them when maybe choosing insurance policy without specifically promoting an insurance company right now? Like what's something that they should look for when they're picking that policy?
Honestly, if I had to make any suggestion to anyone in terms of insurance coverage, so to anyone who's trying to pick an insurance policy or whatever, I mean, I'm not really an expert in insurance coverage and things like that per different insurances, but I think that I see a lot of places. I listen to a lot of podcasts and things like that about it. A lot of clinics are going cash based, and it sounds like those clinics have more freedom in terms of what they treat and how they treat, because they're not under the scrutiny of the insurance companies anymore. So I think that if I had to make any suggestion, it would be to find a physical therapy clinic that will write out a super bill for every treatment, so you can submit it to your insurance company and hopefully get reimbursed for that visit, rather than just doing it solely through the insurance company and paying a copay that's probably close to the amount of the cash rate of where you're going.
So by doing cash pay, the patient would actually save a lot more money.
I'm not going to say that they would save more money. I can say that there are patients that come in and their evaluation with their copay is almost $80 more than the cash rate of the clinic that I work for. But once they decide to use their insurance, they're stuck using their insurance. So my only advice would be to just do your back end research on your insurance company. If you're someone who tends to use physical therapy a lot, and that, you have a lot of back pain, or you run a lot and you tend to notice that your knee and your hip tend to act up, and you find yourself in a physical therapy clinic every so often, make sure you do your research on what kind of coverage that insurance company has for physical therapy. So that way you're not paying a huge copay every time you go in, because physical therapy tends to be something that lasts, over the span of a few months at a rate of, a couple of times a week at least.
Okay, well, that's really good advice. Thank you for sharing that with us. For those listening right now, what are 3 things you'd like people to take away from this topic?
I'd say that I'd like them to take away that, you had it's so tough. Three, Johnny, come on. Hold on, let me think for a second. So the first thing I'd like people to take away is that there is an option for them besides surgery and medication when it comes to men and women's pelvic health. I'd also like people to take away that, just because, statistics dictate that things are one way, i.e. in this case, most pelvic floor physical therapists happen to be female, that should ever be a deterrent for you pursuing that, a specialty, no matter what it is. I'm not just putting that on pelvic health at all. And then to do your background research on what you want to do, so that way you could have the greatest impact on whatever population it is that you want to impact. So yeah, those are my 3 things.
That's great. So next question to you, and I think this is very important. As a patient, when you go to a clinic, what are some things that you should look for when you choose to work with a physical therapist? Because, there's so many different personalities, and, what might work for one person might not necessarily work for somebody else.
I mean, this is going to sound awful. The first thing you should look for are red flags. We've seen so many things in the media. I'd hate to bring this one back up again, but we remember the Michigan State coach that was posing as, doing pelvic floor physical therapy with ultimately children. So, he was trusted by the family though. So just, you got to look for red flags immediately. That should be the first thing you look for when you go into a physical therapy clinic, because, you just don't know. You never know. So I'm a big proponent of patient safety in that light. So that would be the number one thing that I'd have say to people to look for when they're looking into physical therapy places. Reputability. That's pretty much it. Can you trust them? But yeah, when it comes down to it, also, I guess the credentials of those people, their working experience. I don't think that someone having a ton of letters at the end of their name is particularly important, because all that means is that they have certification, and some of those letters can come from certifications that they got over the weekend. It doesn't make them a specialist.
That's really good to know. And I wasn't even aware that guy was pretending to be a pelvic floor specialist.
He was I don't want to get too much into it. It was a little while back, but it was the Michigan State. He was the Olympic coach for the gymnastics team, and he was a doctor, but he was ultimately, not respecting these young females' anatomy and calling it pelvic floor physical therapy. So that's just something I am very very big advocate of, is just making sure that people are safe, and you do your background research. I actually wrote an article on new grad physical therapy about ways that patients can better protect themselves, and how physical therapists can make sure that there's patient safety is undoubtedly happening in their clinic.
Last question for you, Nick. How can people find more about you online?
They can go to my website at drnicholasvernolajr.com, as if that wasn't the longest name in the world. But it's drnicholasvernolajr.com. And then also, you can go to, if you're a physical therapist who wants to be a pelvic floor physical therapist, I started a Facebook group a while back, a private group for those who want to become them, called Aspiring Physical Therapists and Physical Therapy Assistants, just to give people a place that was safe to ask questions about breaking into the field of physical therapy, because that was something I struggled with initially, was finding someone who would take me as a student and allow me to work in a clinical setting as a pelvic floor physical therapist. It was actually very hard in the beginning for me to break into the field. So a place to find out more information about me, I guess, would be Aspiring Pelvic Floor Physical Therapists and Physical Therapy Assistants on Facebook.
Great. Well, thank you so very much for being on the Power of Your Voice podcast, Nick. I definitely greatly appreciate it. Thank you, buddy.
Yeah, my pleasure. Thank you for having me. It was a enlightening experience for everyone, I'm sure.
Thank you. Johnny here. Thank you for listening to the Power of Your Voice podcast. I'd love to get your feedback on this episode and how it impacted you. If someone in your life could benefit from this episode, share it with them. Check out thepowerofyourvoice.com to read show notes, leave a comment on the blog page, and to stay updated on all future episodes, subscribe to this podcast and leave a 5-star review. Thank you for your love and support.